Hi, it's Patrick Hutzel from intensivecareathome.com.au, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomy by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I shared the 3 reasons why long-term ventilated adults and children with tracheostomy and their families can do so much better. You can check out last week's update by clicking on the link below this video. In this week's blog, I want to talk about long-term mechanical ventilation in intensive care with tracheostomy. What are the best options? Some patients in intensive care are facing the dilemma of being ventilated for a much longer time than expected. Whenever those patients in intensive care are facing the dilemma of getting a tracheostomy and then go through multiple failed weaning attempts, or don't even get to those weaning attempts in the first place because their clinical condition doesn't allow it, that's when patients, their families and intensive care units are in real trouble. More often than not, those patients are then stuck in intensive care with the limited quality of life and or quality of end of life for many months to come. More often than not, those long-term ventilated adults and children with tracheostomy are then also blocking a bed that could be used for those many other patients in need of an acute intensive care bed. So, what's the alternative and what are the best options? Keep them in intensive care for a long time to come? Getting the patients and their families involved in the decision-making process? I think that would probably be a good starting point. And furthermore, we should also be looking at what proven alternatives are out there, rather than keeping long-term ventilated adults and children in intensive care for longer than necessary. Intensive care at home is offering a model of care that has been proven in many European countries a long time ago, and plenty of research has been published about it. For example, the mechanical home ventilation guidelines have been published to provide intensive care in the home services as a genuine alternative to a long-term stay in intensive care. Those mechanical home ventilation guidelines are a set of guidelines that are a direct result from the many years of experience when looking after long-term ventilated adults and children with tracheostomy in the home. Check those guidelines out on our website. Furthermore, quality of life evaluation of patients with neuromuscular and skeletal diseases treated with non-invasive and invasive home mechanical ventilation is another research paper that is available in the written version below this video. Another research paper is Invasive Home Mechanical Ventilation, mainly focused on neuromuscular disorders. The research and the evidence is there, therefore we should not deny long-term ventilated adults and children with tracheostomy the opportunity to go home. What are your thoughts? Do you think that leaving long-term ventilated adults and children with tracheostomy in intensive care is the best option? Leave your comments on the blog. Please also note that Intensive Care at Home has been selected as a preferred provider for Queensland Health Services as part of the recent Hospital in the Home tender. You can contact me on 041 094 2230 if you want to know more about how we can help you, your intensive care unit and your patients and families. Thank you for tuning into this week's blog. This is Patrick Hutzel from intensivecareathome.com.au, and I'll see you again in another update next week.